guys, it's Khaki. Today I would like to talk about a topic that has been requested by several people and something that I think is very confusing for a lot of folks considering bariatric surgery. Insurance. What does it cover? Will it cover anything? So, as a healthcare provider, I deal with insurance on a daily basis. So, this is something that I have experience with both as a bariatric surgery patient and on the other end of the spectrum as somebody who has to navigate insurance as a provider. So, what I would recommend when you are starting the initial thoughts of bariatric surgery, call your insurance company. Call the number on the back of your insurance card and ask them, do you have coverage for bariatric surgery? At that point, that's all you need to know. If they say yes, ask them who within your area is in network with your insurance because here again, some providers are in network and some aren't. Once you have that information, you can move forward. Now, if your insurance is a hard no that they do not cover bariatric surgery, hang out till the end of this video and I will tell you some suggestions that I have for folks who are in that situation. Now, every insurance is different. You cannot assume just because you have Blue Cross Blue Shield and your cousin has Blue Cross Blue Shield and they covered her insurance that yours will as well. Every insurance is different. Even within the same company, the same employer, a lot of times there are different tiers of insurance to choose from. So you don't need to go by what somebody else, even with the same flavor of insurance, has told you. Check for yourself. Once you determine that insurance does cover your procedure, I would reach out to whatever surgical team that you're interested in, and they can check the individual requirements for your insurance to cover bariatric surgery. Most of the time, I find that patients have a hard time getting that out of their insurance company. The nitty gritty details of what you have to do to get it paid for. The more common things that I see as a healthcare provider with insurance and bariatric surgery is that, of course, bariatric surgery is subject to whatever your deductible is. So if you have I'm just going to say $1,000 deductible per year, nothing will be covered with most policies with your bariatric surgery until you've paid that $1,000 either to the bariatric team or to other healthcare providers for your needs. Most insurance also has a copay. For example, my copay is 80%. After you meet that deductible, you have to pay the 20% that is left behind after insurance pays. So, for example, let's say your surgery is $20,000. After you've met your deductible, the $20,000, you would be responsible for 20% of that if you do have that 20% copay. So $4,000 out of pocket if you've met your deductible. The other things that insurance almost always requires are for you to meet certain criteria. There are very broad criteria. For example, if you have a BMI of over 40, most insurance that covers bariatric surgery will cover you. If you have a BMI over 35 with specific comorbidities, such as high blood pressure or sleep apnea, or any type of health condition that could be negatively impacted by your weight, a lot of times insurance will cover that. The requirements for each individual insurance varies. What I see a lot is insurance requiring a specific number of visits with your PCP or your surgical team if you don't have one once a month for so many months to document your weight. Also, they want us healthcare providers to put in the note that we talked about healthy eating habits, that we talked about increased activity. I'm sure your healthcare provider is very used to doing these visits. But most common in my area, which I'm in Middle Tennessee, most insurance requires either 3 or 6 months of visits with the PCP to show a documented weight loss. Now, here's a tip. I've had this happen to several patients. If your insurance requires 6 months of documented visits and you miss a visit, there's a month that you're not able to go, a lot of times you have to start over. Had that happen, I can think of probably 3 times to a patient. Life gets busy. You may forget. You may have a visit scheduled on the 30th of November, and your child is sick. You can't go that day. Well, you didn't get a visit in November. Keep that in mind. So just think about that. Find out if your insurance company does that. If they do, if you miss a visit, you're going to have to start over. Don't make those visits the last day of the month. Give yourself a little bit of time to recoup if something comes up. Almost all insurance companies that I deal with also require a psychiatric consult. Your practice that you deal with will tell you who they accept that psych consult from. And, they can give you some guidance who's in network with your insurance. The provider, the surgeon that I went with, there were some choices that were completely online. I did my psych consult via Zoom. It was not a big deal. It was very easy. I've heard other people's experiences are not as good. So just find out what is required and what is accepted by the practice you're looking at. Almost all insurance requires so many dietitian visits before you can be approved to talk about how you're going to have to eat after you have surgery. They also may require so many support group meetings for you to attend. Also, of course, meeting with your surgeon so many times. I do run into occasionally an insurance that will require you to lose a certain amount of weight before they approve you to show that you are willing to be dedicated to the process, which I find kind of silly because if any of us, or I'd say most of us, could lose weight on our own, we wouldn't be seeking bariatric surgery, but that's something to keep in mind. Now, aside from what your insurance requires, your surgeon may have requirements. I have the practice that I dealt with, even with cash pay patients. They require them to have a psych consult. They require them to meet with a dietitian so many times. They require them to have so many visits with the surgeon. So you've got 2 separate sets of requirements that you have to worry about. One other thing that I will say, I have run into this a couple of times. If your insurance is one of those that requires so many months of documented weight with your PCP, if you're a patient who goes in to see your PCP frequently for refills or other issues, sometimes those visits can qualify. So if you're on medication that requires you to come in every month for a visit, like ADHD medicine is a frequent one in our area that you have to come into the office, find out, have you gone every month and will those visits qualify? The other thing that almost all insurance requires and almost all practices, surgical practice requires, is a letter of support from your PCP. Your surgical office normally will provide a form letter for your PCP to go by to tell them what the insurance is looking for in that letter. I have had people come to me who I have never been their PCP, that their primary care provider refuses to do it, that maybe they are not a believer in bariatric surgery, so they get established with me. We talk and I write the letter for them. I have written probably over 100 of these letters for people, and most healthcare providers have absolutely no problem doing that. I will recommend you keep a hard copy of everything. Don't just put your faith in your healthcare provider to fax everything for you and let them handle it. Request a copy for you to have as well. So, we talked about insurance requirements and then the separate surgeon requirements. So, what happens if you call your insurance company and say, "Do I have coverage for bariatric surgery?" And they check and say, "Nope, sorry." Well, the first thing I would do is if you get your insurance through an employer, go to your HR department and find out if your employer offers different tiers of insurance. One of the common employers in our area offers, I think, 4 different choices in insurance, and you can change that every year. 2 of those that are the least expensive do not cover any weight loss treatment. The other 2 do. So that might be something to check and see. If you have one of those tiers of insurance that do not cover it, ask your HR if they do, and if others do cover it, when can you change? That's one way to get it covered by insurance. Another thing, if you have private insurance, seek out who you have your insurance through. See what other options that they have that might cover your bariatric procedure and see when you can change to them. Now, there are going to be folks who just do not have insurance coverage for bariatric surgery. So, what about them? A lot of people are reluctant to have surgery outside of the United States. I get that. I would have to really think a lot about it. I've had many patients, I've had friends who have gone to Mexico to have gastric bypass or sleeve or plastic surgery and have had great outcomes. But I can understand the reluctance to do that. There are places in the United States, surgery centers, that do specialize in providing care to cash pay patients. As I said, I'm in Middle Tennessee. There is a surgical practice that I have had several of my patients use in Huntsville, which is Huntsville. I'm sorry, I was going to have this pulled up. Alabama Surgical Associates. They offer very competitive cash pay pricing. Checking their website, a gastric sleeve, including all follow up for a year with the surgeon and with the dietitian, and all your preoperative testing and the surgical facility fee is $9,995. Gastric bypass, same, all inclusive package is right at $12,000. When you factor in transportation cost, that might be, even though Mexico is cheaper, that might be something to look at, especially if you're one of those folks who is a little concerned about having surgery out of the country. Looking at cash pay pricing in Mexico, I found several facilities that offer gastric sleeve for about $6,000 and gastric bypass for about $8,000. Now, I will tell you, if you plan on having surgery outside of the United States, have a plan. Contact some bariatric teams in your area and ask them if they will be willing to take over your postoperative care. Don't be surprised if that's hard to find. Some surgeons, malpractice insurance prohibits them from doing it. It's not that they have anything against people going to Mexico for surgery. It's just they can't. They're banned from doing it. If you have trouble finding a surgeon who will follow you, talk to your PCP. They may have some ideas or they may follow you. You cannot be refused care if it is an emergency, but you can be refused for somebody to do follow-ups with you if it's a non-emergency situation. Another thing to consider is whether your insurance will cover any complications, or anything that they consider secondary to your weight loss procedure. For example, people who lose massive amounts of weight often develop gallstones and need their gallbladder removed. Check with your insurance if you have surgery in Mexico or that your insurance doesn't pay for in one of the other places in the U.S. that specialize in cash pay patients. Will that be covered? Now, the chances of that happening are very slim, but it's something to keep in mind. So, guys, I hope this answers some of your questions regarding insurance. If you have any other questions, please put them below. I'd love to hear how your insurance worked. Did it cover your procedure? What did they require you to do to get it covered? If you did not get your procedure covered, how did you handle it? Where did you go to have it done? How were you able to pay for it? I know some people do care credit, some people do loans, borrow from their retirement. I'd love to hear if you're comfortable sharing that. If you have any other ideas for a video on topics that you would like to see me cover, please put it below. I would love to talk about what interests you. I hope everybody has a great week, and I will see you next Wednesday. Bye.